I am the Tofu Golem. Please enjoy the video.
You start by ensuring the skin is clean and free of oils so the cream penetrates. Apply a thin 0.5 to 1 millimeter layer of Dr. Numb directly over the design area. Do not rub it in aggressively. Once applied, cover the area with plastic wrap to occlude and enhance absorption for 20 to 30 minutes. Make sure to avoid open, bleeding wounds. While you wait, prepare your equipment so you can move straight into tattooing once numbness sets in. Once numbness begins, test the area with a light sterile pinch or needle prick to confirm reduced sensation before starting. During long sessions, recheck every 30-60 minutes. If sensation returns, wipe excess with sterile gauze and reapply a thin layer, then recover for 10-15 minutes. Make sure you track total applied amount and area size so you stay within recommended dose limits for safety. While working, communicate with the client about any tingling, dizziness, or unusual reactions immediately. After finishing, remove Dr. Numb completely with soap and water, then clean the tattoo per standard aftercare and apply protective ointment. If the client develops redness beyond expected, swelling, rash, or breathing difficulty, stop immediately, wash the area, and seek medical help. These can signal allergy or systemic absorption. If numbness was inadequate, try extending occlusion time or reapplying a small amount in a controlled way. Otherwise, consider a professional anesthetic alternative. Always document dose and client response for safety.
Thanks for watching. Consider subscribing if we helped you today.